the truth about fibroids is, sorry to bust your bubble, it's actually also very common, and almost in 10 women, about 6 or 7 of
Are you
them
for real?
must
Yeah.
have it. Now, the issue with fibroids is that women can have fibroid, but until it becomes disturbing,
Yeah.
they would not present. They may not even know. It might be asymptomatic. They wouldn't know. Now, what makes women come to the hospital as a result of they end up diagnosing fibroids is as a result of painful menses and heavy bleeding.
Yeah.
So once the menses is very painful and then they have stomach aches and then the bleeding is becoming too much, then they come and then they discover that okay, there's a fibroid in here. Most of them really do not know. And fibroids can coexist with a pregnancy in the womb. Fibroids can stop you from getting pregnant. Even if someone has a pregnancy, is carrying a pregnancy, and the person also has fibroids, the person can still carry the pregnancy, provided that that pregnancy does not disturb the fibroid and the fibroid does not disturb the pregnancy. The two of them can coexist. But if it becomes something that would threaten the woman, maybe during the process of trying to push the child out, it's kind of dislodging the fibroid such that the person now starts to bleed heavily and all that. That is when you consider removing the fibroid. But most times, if it's not there's a saying in Owanji, if it's not disturbing you, you don't disturb it. Just leave the fibroid.
Welcome everybody to another episode of Yarns and Trends. You know what we do here? We bring hot topics, not just trends, but stuff that could educate you guys. And today is no exception. Today we're going to be delving into yet another very sensitive topic, very sensitive. And that's why I said it's about to be hot in here. But before we start, I'd like to introduce myself. I'm your host, Prodigy. And I'd like to introduce my beautiful co-host.
Yeah.
The opinionated Miss Harry.
Hello, guys. Hi, guys. Welcome back to another episode of the Yarns and Trends. Love you. Kenny.
And the beautiful, sexy
Awaniel.
Christine
Oh,
Kelani.
new level.
Hi guys, welcome to yet another sweet episode. We hope you enjoy.
Okay, joining us on set today, because we said today, the topic is not something we can actually crack open ourselves. So we had to invite somebody very special,
Yes.
a medical student. Not just a medical student, a very bright one anyway. So,
Yeah.
joining us today, should I call you Chief Isaac?
I think Isaac is just fine.
Oloye.
Isaac,
Yeah,
what's up, Chief?
I'm fine. I'm good. It's
Alright.
nice to be on the show.
Apart from PCOS, in that very tweet, they mentioned some other Gen Z
Illnesses.
associated health issues.
But why are we tagging it
Gen
Gen
Z,
Z
yeah.
though? I feel like that's a very wrong way to put it.
For you to say that they are hereditary and they are not saying
I see no
it's
reason
Gen
why
Z.
it should be Gen
It's
Z.
wrong, right?
Yeah.
To
Yeah,
call it
very
Gen Z.
wrong,
That was
though.
why I asked that question the other time.
Because
is
these
it-
people, that's why I was saying, get enlightened. Gen Z.
So it's basically not
Doesn't
Gen Z.
sit well.
But all these other health issues like fibroid, like all those other ones you guys mentioned.
Funny how fibroid, I barely hear fibroid with Gen Z women. I think I hear mostly
my
with
aunt had
my aunties.
Yeah.
Yeah.
Now, the truth about fibroids is, sorry to bust your bubble, it's actually also very common, and almost in 10 women, about 6 or 7 of
Are you
them
for real?
must
Yeah.
have it. Now, the issue with fibroids is that women can have fibroids, but until it becomes disturbing,
disturbing,
they would not present. They may not even know. It might be asymptomatic. They wouldn't know. Now, what makes women come to the hospital as a result of they end up diagnosing fibroids is as a result of painful menses and heavy bleeding.
Yeah.
So once the menses is very painful and then they have stomach aches and then the bleeding is becoming too much, then they come and then they discover that okay, there's a fibroid in here. Most of them really do not know. And fibroids can coexist with a pregnancy in the womb. Fibroids can stop you from getting pregnant. even if someone has a pregnancy, is carrying a pregnancy, and the person also has fibroids, the person can still carry the pregnancy, provided that that pregnancy does not disturb the fibroid and the fibroid does not disturb the pregnancy. The two of them can coexist. But if it becomes something that would threaten the woman, maybe during the process of trying to push the child out, it's kind of dislodging the fibroid such that the person now starts to bleed heavily and all that. That is when you consider removing the fibroids. But most times, if it's not disturbed, there's a saying in ONG, if it's not disturbing you, you don't disturb it. Just leave the fibroids.
I've actually heard of cases where doctors have advised not to take out fibroids. Like I heard that is maybe too little or in size or something.
Yeah.
Something
If it's
like
not
that.
causing you any immediate,
But I've also
just
seen
let it
someone
be.
with fibroid that looked pregnant. I actually thought she was pregnant for months, but I later heard it was fibroids. Like, are there cases where women who have fibroids look like they're pregnant? Like, she really had.
Yeah, one of my church
Yeah, I think
members.
I've heard that.
My
too.
One of
aunt.
my church
the
members.
thing is that the fibroid,
It grows now.
it grows inside the, I wouldn't say, it grows inside the uterus. Or it has various locations within the uterus where it can grow. But basically, the common ones that we're used to, it grows within the uterus. And it's also, and that's where the baby also grows, within the uterus. And if it continues growing, it can also appear to look like someone is pregnant. And it will give the woman the appearance of an enlarged stomach. But it's on palpation when you start to touch it and you see that, okay, this is not how a baby should have this at a particular stage. A baby should have this, and you're touching around and you're not seeing that. And then you see the consistency is not like that of a baby, but like that of a gynecologist would be able to tell the difference from just palpation and having other maybe a transvaginal ultrasound or a pelvic ultrasound to kind of like differentiate what is and the location of where that particular fibroid is. Those are also some of them. But the thing is that yes, it can look like a pregnancy.
Okay.
And not everyone that has big stomach is actually
Exactly. Is it
pregnant.
life-threatening when it gets to that point?
It depends on what the gynecologists say.
Okay.
Like, for instance, if you discover that, okay, you're having an excessive protrusion and it's not causing you any pain, but you feel like, okay, for the aesthetics, I want to remove it, then you can remove it. Although it's, even if the doctor advises, if you say this is what you want to do, they can only advise. If you say this is what you want to do, they'll still end up doing what you want them to do.
Okay.
Is there a level to which the fibroid would grow in the uterus? A pregnant woman, if a woman is pregnant, it starts from stages.
Yeah.
1 month, 2 months, 3 months. Then her stomach gets like really big when she's 9 months. Yeah. But when you talk about fibroid, you're saying your stomach start protruding out. So is there a stage at which, and you are saying there could be an advice not to remove it. So would it get to a particular stage, like will your stomach just keep getting bigger and bigger and bigger?
No, I don't think it will continue to get big and big.
It will stop at a
By the
particular
time
point.
it gets big and big at some particular point, it will start to cause other issues, like maybe injuring, maybe it will cause things like constipation. It will cause things like difficulty urinating. It will start having things you call pressure symptoms. Like it will be either occluding one part of the body or pressing on the other part of the body. At that particular point, it's starting to be symptomatic. It's starting to affect your normal way of life or your normal daily activity. At that point, it should be removed.
Okay.
Once it starts to, it's not like you leave it to grow big and big and big. Well, once it starts to significantly affect, there's no how that thing would become that big. It will not be painful. There's no how it will not result in heavy bleeding. There is no how you will not feel pressure symptoms. At that particular point, it should be removed.
Okay.
So I also heard somebody in the tweets that you talked about earlier. Somebody also mentioned people who live recklessly are prone to have these ailments. I just need a professional.
No, which of the ailments?
Fibroids, PCOS, and all of that.
For fibroids, I'm not sure there's anything you can do about that one. Also for
Let me be
PCOS,
clear. They said
Recklessly.
people
In what
who
way?
have had multiple abortions are more prone to having these ailments. And if I'm saying no, it might seem like, okay, I'm supporting my
Gender.
so
okay, I don't know. When I was in ONG posting, in 400 level, I saw a lady who just newly got married. I think she married kind of late. I think she was already in her mid-30s and she was a virgin. Her stomach was slightly protruded and she had fibroids. So to tell you that it's not a respecter of anybody, does not care whether or not it's common.
Thank you very
common
much for that.
whether or
Chief.
not you have done it for fibroids. I'm saying for fibroids, it's pretty common. Doesn't really depend on whether, although there are other risk factors to it too. There are risk factors, that things that can predispose somebody to it, but it's still relatively a common thing.
Okay.
Thank you.
Thank you very much.
Can you
Chief.
tell us about thyroid disease? I think that one too is kind of prevalent now.
Yes, thyroid diseases too. It depends on which type of thyroid disease. Is it hyperthyroidism or hypothyroidism? In cases of hyperthyroidism, it's either that
The one common in women
I think
now,
it's hyperthyroidism that is common in women now.
I really can't say which it's, because I'm not on those threads that say which is which and what isn't. But for hyperthyroidism and hypothyroidism, they can also generally any changes in thyroid, because the thyroid also has to do a lot with metabolism, and the thyroid is also important in protein metabolism, carbohydrate metabolism, and the way the body metabolizes things. Now, so if there is any changes in the thyroid hormone, it can affect how somebody would be eventually. Thyroid hormones can also be implicated in things like PCOS. It can also be implicated, and which other thing? Also, iodine metabolism. People with goiter all these are a result of deficiencies and with the thyroid gland and thyroid hormones.
People with low iron, how and why are they always dizzy and I don't know, woozy and all of that? Why is it so common in women? Why?
Yeah.
Now, the reason why iron is what do I call it? The reason why people that lack iron, it's not like they lack iron or something, or iron deficiency. It's a kind of anemia. We call it iron deficiency anemia. Now, anemia is a result of, is when the PCV or the packed cell volume, or let me say the hemoglobin level of an individual is too low. Now, the hemoglobin is what carries oxygen. And if what carries the oxygen carrying pigment of the blood is too low, automatically the person will feel lightheaded, the person will feel dizzy, the person will feel like he or she, and if it gets drastically low, the person will faint, because there is no enough oxygen supply or enough pigments to carry oxygen to where the body needs it.
Oh, I get it.
So how can you help the low iron deficiency anemia?
Since you said it's common in women, it would be definitely women that lose a lot of blood would have that issue.
Really?
Where, yes, if you lose too much blood, at the end of the day, you just feel lightheaded.
Okay,
I think did you ask that question for Christy?
No,
because our reactions.
No, I actually do always feel lightheaded when I stand up
Like
too fast.
always.
No, when you stand up
time.
too fast, not
Yeah.
as a result of
Like,
not only when I
sometimes
I might be sitting and
I'm like,
when I just
stand up.
like I'm feeling like this is like how
Okay,
to fall.
I think that is that we call that hypostatic. Is it hypostatic hypotension? Yeah, something like that. I think I also kind of like experience it when I kind of like stand up. I feel
once in a while I've
lightheaded,
experienced it.
because I think that one is more as a result of
I think low sugar causes that too. Low
blood sugar can cause symptoms of dizziness. Yes, it can cause symptoms of dizziness. But this one is not really because of low sugar. It's probably because your body is at a state of rest, and the rate now when your body is at a state of rest, your heart isn't really pumping as much as it needs to pump, and then you just suddenly stand up, and then your heart has to like adjust to that sudden movement. So automatically it will pull blood away from the part of your body that is resting to your legs suddenly, because your leg now needs to like move. So that would make you feel like okay,
so I'm going to counter that. Okay, in a case of someone who just finished Mekwen.
Oh God.
You are very dumb.
Do you understand?
How did you think of that?
Who just finished having sex?
Yeah.
That's a
It's a
physical
McCoy.
exercise.
Yeah.
The sex on its own. And
Really?
It
stands up.
really is.
It is now.
Wow.
All that
sex
bending
exercise.
and twisting.
Eh?
Sex exercise. So, and the person stands up and feels the same thing and slumps.
The orgasm took you to heaven.
Well, what can I
In
say
this
about
kind of
that?
case, this person is what the blood is flowing, definitely.
Well, the person is should we say first, there are so many things that could cause it. Is the person on drugs? Is the person on drugs? Yeah, true. The person can also have a cardiac arrest.
Cardiac arrest,
The
right?
person might be having an underlying heart condition that the person doesn't know about. And there are things about heart condition. The person would have probably otherwise slumped. It's just that the person was having sex previously. If the person had probably run an 100 meters race, it might have still resulted in the same thing. So it's either the person had an underlying cardiac condition initially, and then the person had did something strenuous on top of it, and then the heart gave way.
Let's just be superstitious and say that God has
God
said that is the way that it came is going to go back.
Well, people say that, but the pathologists will argue. Yeah, the pathologists will argue
the
otherwise,
pathologists will
because by the
argue.
time they do an autopsy, you probably find out that definitely it's probably
Maybe
that the heart
cardiac
gave way,
arrest.
or maybe the person took an overdose of Viagra.
Yeah,
And
that's
OD of
Yeah, that could
Viagra,
cause it.
OD of Viagra too can also kill, because it takes the mechanism of action. It increases the sensitivity in the penile region, and then it takes all the blood, or a very large quantity of the blood, and pushes it there and keeps it there for a long time. There are other parts of your body that need that blood. So if they are not getting that blood supply, those are some of the things that can
Can
also
I ask
lead
an
to that.
unserious question?
Okay, I want to give an answer to the question you asked about the iron deficiency.
Okay.
Now, for women that experience things like iron deficiency and that dizziness and stuff, they always put them on imatinics. Also, for pregnant women to also suffer from a kind of iron deficiency anemia, or if they are not if you're not eating right, if you're not taking enough iron, if you're not eating foods that are rich in iron and the likes like that, and you're then losing blood, you definitely suffer from. So you need to replace that. So things like blood tonics and other imatinics can also be used to manage that condition.
Thank you, Chief. Now to my
Thanks, Chief.
unserious question. Where do we go when we faint?
I have a question that is
Where
serious
do
though.
people go when we faint?
I
was... Why?
I've never really thought about
I've
that.
never
Your mind-
fainted. Where do they go when they faint? Like,
Some people will
I
be
mean,
like,
I
you are
lost-
you're
Yeah, between heaven and earth.
are you unconscious? Because you're still breathing. So I can't say. I don't know.
I think-
Okay, like
Let me-
when you're
let
in
me-
coma, where are you?
I think the thing is that medically, I'm not sure there is anything like a spirit in medicine.
There's no in between.
But
So there's no
now,
spirit.
Now,
when
the
you
thing-
you'll be outside like
Now,
this.
the
beside
thing
You're
is that-
going to be looking
Are
at
you
the bed now.
That's Nollywood
I
movie,
think,
man. That's
I think that
Nollywood.
one that becomes maybe the supernatural where we start talking about that, but I'm not sure. Medically, when somebody is in coma, it's the person as what controls the entire body is the brain. It's the brain, literally. That's why when you say someone is brain dead, the person can't do. The person would be breathing, and that's because there are certain instances where the person might not even be breathing, and the person would
the organs are working fine.
ventilators that the person uses to survive, because if what tells you to breathe unconsciously, they are breathing, you don't have to think before you breathe, is the brain. There are parts of the brain that tells you to breathe. There are parts of the brain that tells your heart to beat. You're not the one controlling that. There are parts of the brain that tells you to move. There are parts of the brain that controls posture. So when someone is in coma, it's like the brain just goes to sleep, and every other part of the body, although there are certain parts of the body that to tell you that, okay, these are parts of the body that I don't need to be awake for those parts of the body to function. Things like my heart beating. Sometimes when I sleep at night, I don't have to control my breath. My brain does all that function for me. Things like what other things do your brain need to, like your bowel movements, you're not the one in control of that.
Yeah.
Your digestion of food, you're not the one in control of that. Your brain handles all those functions. Those are the kind of things. So someone can be in coma, someone can faint, and it's like your brain goes to sleep
I see.
indefinitely till you wake up again. That's just
So
how
this
it is.
myth we see, no, I'm not going to call it a myth. This thing about Nollywood, when somebody's in a coma, is it always true that it's your fingers that move first, and why does it happen? Is it true? Is it a real
Too
thing?
much, you know.
I'm asking. I've always been wondering, is it a real thing? Is it something that
Like,
happens?
Well, it does happen. Especially, I don't see a lot of
Finger will just go.
Like everybody, for every person that is in a coma in a
The
Nollywood
finger
movie,
is always
it's
It's always the finger that
"Ah!"
switch first.
Yeah.
Well, like, it's just the same way when you're sleeping, and then the very first part of your body that you start to first jerk or
Your
turn
arm.
around first before you are awake. It's kind of like your body just waking up your extremities.
Okay.
So for people like that too, it's something very similar. Like, your brain goes to sleep, and then the very first thing is, okay, your body's still trying to
Okay.
jerk, and
So it's a thing. It's an actual thing.
yeah, there are things called reflexes.
Oh, okay.
There are
That makes
reflexes.
sense.
You don't have to. Your brain just checks.
Yeah.
Okay, this part still functions. That part
That
still
makes sense.
functions.
That makes so much
Okay.
sense.
Is there a chance that a woman with ectopic pregnancy can actually have the baby, or they always have to get rid of the baby?
Now, the problem with ectopic pregnancy is that ectopic, from the ectopic itself, means the implantation is not happening in the right place. And if the implantation is not happening in the right place, that pregnancy wouldn't survive.
So
Oftentimes,
it would never
the right place
survive.
for a baby to develop
Is the
is
ovary.
in
The
the
uterus.
uterus. Now, there are certain times that ectopic pregnancy occurs in the ovary. It can occur, and those are, if a child starts to develop in the ovary or in the fallopian tube, it would rupture. If that child grows large enough to the fact that it ruptures the fallopian tube, it compromises that lady. And we call something ectopic pregnancy like a black cat in the night, because the way it kills women very silently, very, very silently. Because before you discover that, it's ectopic pregnancy, the woman is most likely gone. So cases like ectopic pregnancy are always very sensitive, and the moment a woman discovers that she's pregnant or she's no longer seeing her menses, it's always best for her to diagnose that pregnancy and to know exactly the location of that pregnancy, to be very sure that it's not ectopic. Because if it's ectopic, those are one of the things that, yes, abortion is not legal in Nigeria, but those are one of the things that they will abort that pregnancy as fast as
Immediately.
possible, because it will threaten the life of that woman.
Okay. What men who have erectile dysfunction, what do you think they can, do to manage?
And
Or
what could
do
be
you
the cause?
Do you think that it can be cured? Can they help it? Can they improve? Can their sex life improve?
Well, it also kind of develops. It also kind of determines what is causing the erectile dysfunction. For some men, it could be psychological. Like, I don't think. I just want to give an example. I don't know if it applies. Say someone that lost maybe millions, and
Sorry?
I'm not
Say that
lost
again.
millions.
Oh, okay.
I'm not expecting his performance to be very good, or his performance to be anything
know
at
if
all,
good or bro,
actually.
like-
So if it could be psychological,
Okay.
it could be stress. You might be having a very bad time at
Stress,
work.
yes.
You might really,
Okay.
your boss might be breathing down your neck really badly, and maybe you wouldn't really have that
Maybe
much
fear of performance, like would I do well? Would I-
performance anxiety too can also come into
performance
play,
anxiety,
and
okay.
those are the things that can also affect. And then it could also be an hormonal imbalance. Maybe someone that is not
Men have hormonal imbalances.
Yes, men have hormonal imbalances. Anyone can
Wow.
have hormonal imbalance, because what actually makes a man is testosterone, and then testosterone is within ranges. And if you are below the lower
Normal,
limit of the range, you probably won't have strong enough erection or all that
The
components.
2 minute-
But
So-
just like she has all these things has cure, right?
Some of them have cures and some of them have management.
Like the
Okay.
low, what did you call it?
Erectile
Iron.
Erectile dysfunction.
dysfunction.
Viagra undo things like erectile dysfunction. That is basically what
But those
Viagra
don't
is for.
correct it.
Or it does not correct
What
it.
do they call this? 2 minute?
It doesn't correct it, but that is
Management.
why
What do
the stuff is there. The drug is there to just help you manage it. So it's not everything that has a cure. That it depends on what's causing it. If it's psychological, we know that if you take away the stressful environment,
Then we
if you
will
take away
go
all
back
these
to
things, this
normal.
person will go back to normal. But if it's something like maybe aging, you can't correct someone's age.
Yeah.
You can't reduce the age, but then the person still wants to perform like a 20-year-old,
Yeah.
you have to be on pills to do that.
Viagra. Okay.
Those are some of the things.
Okay, thank you very much
Thank
for that.
you.
I hope the men have learned that.
Learns what?
Whatever it is, they learned.
Thank you.
From that.
And I think that there are a whole lot of erectile dysfunction though.
Yeah.
There are different types now. There's the weak erection, there's
Weak erection.
quick
Quick
ejaculation.
ejaculation. Yeah,
There's,
that's.
Which one
Sorry.
again? I know there are different.
The thing about the men is the erectile stuff and all that. For erectile dysfunction, yes, if it's something that is caused by stress, age, we have work to do to that. For the quick ejaculation, well, that could also be a psychological thing,
Okay.
and it could also be a thing of sensitivity.
Sensitivity. You see one
Yes.
very sexy, fine woman.
Now,
no fit
in the
control
place of
yourself.
sensitivity, it can be like
Yeah.
now. In the case of sensitivity, it can be like maybe the shaft of the penis has like the nerve endings on the shaft of the
Okay.
penis, and then at the glans, which is the tip, it has the most nerve endings on the how do I put it, on the male reproductive organ. That is the tip of the penis is what
Penis.
has the
On the
most
phallus.
is what has the most nerve endings.
Okay.
Although in women the clitoris has
Ah,
more.
but would that
Oh,
be
the
permanent?
tip has the oh, nice.
The tip of the penis has
She's acting like a saint now.
more.
Like she
No.
doesn't know something.
It's giving us fellatio tips.
Now, wow.
No, what I was trying to say actually is like, the clitoris in women is the equivalent of the penis in men. And
Yeah.
the tip of the penis has about 4,000 nerve endings, and I think it's twice that.
4,000.
Yes, I think it's twice that
Wow.
on the clitoris.
Whoa.
Now,
I
so
wonder why
if you
men can't
reduce the
look at it.
sensitivity, you can prolong.
Bro.
You can prolong.
How do you
Duration.
reduce the sensitivity?
There are drugs that do that. Even wearing a condom reduces sensitivity.
Oh.
Oh yeah, true.
That's why some people say, okay, they don't really like enjoy condoms. They don't really feel it like that because it kind of like numbs the
So
sensitivity.
is it normal for a guy to go like 1 hour on a woman? Is it
Ideally, I don't think it's normal.
like clear eyes
Ideally.
though? Like clear eyes
Is it
though?
not-
Ideally, I don't think it's normal.
Possible.
It's possible,
It is
but I do not think. I don't even think it's healthy
Why?
Why?
because the entire point of sex, from my own understanding, is mutual
Enjoyment.
benefit. Yes,
Yeah.
and if both parties are able to climax in 10 minutes,
What if they
15
don't?
minutes,
Mhm.
I feel like if they don't, then somebody is
People
not
like you,
doing
you know, like that
something.
kind of guy.
I feel like
Throw
something.
'em out.
I feel like
I agree to that. I'm
I had a
abstinent.
friend. I have a
If
friend.
people are-
I have
people
a
are-
friend. She was telling me about
Wow.
our experience with one of our ex-boyfriends. She said initially when she started out having sex, because that guy said she made it very comical, such that he was like, it's because he was broke, so he had nothing he was doing.
Oh my
so he had the
God.
time
He
to
had
like
the time.
so
Oh, wow.
now because he had that time, she had the mentality that sex was supposed to be like for 2 hours,
2
and the
hours,
likes
yeah.
like
Oh
that.
my God.
So it was like, broke man now. What, like she will use her money. She will use
He
her
had all
money
the
to
time in
feed.
the
She will use her
world.
money to feed them. Then he will eat, and then the next
And
thing is
then-
they just
He come and perform.
that's what they do.
Mhm.
He has nothing he was doing. So she was like, she ended up breaking up with him, and then she went into a different relationship. She was not like, she went with that mindset that okay, sex is 1 hour, 1 hour 30
45
minutes. So
Do people do
this
that,
new
though?
guy
Yes, sir.
wasn't the whole long, and she felt like she was getting the same and even better pleasure,
pleasure,
from
yeah.
the 15 minutes, 10 minutes that she was getting with this new guy than the 1 hour
It's
she was
not
getting.
actually
She was
about
like,
the-
It's not
Like
how
that.
long, it's about how well.
Yeah.
she was that kind of like
It
made
is.
her perception. So the last time we talked, she was not like, okay, I don't think sex should be. She was even saying it that if you guys can even achieve your stuff in 5 minutes, like, oh well and good, let's all just sleep.
5
At the end of the
minutes.
day,
So
Yes,
why do
ma'am.
women then complain about 2 minutes, men?
Do well.
You would answer that question yourself.
Please
I don't know.
answer
I
it.
don't know. I'm
No,
only,
that's for women who love long. Some people, I
That's-
think they love prolonged sex.
yeah, some
Why?
people actually do. No, there are some people that it's one of their like
You're
1 hour
asking
30
why you
minutes,
be
like rough.
acting like one saint.
I'm
like
not.
one-
I'm just saying like long.
Like people that are into
it's not necessary now.
bondage and this
But-
stuff.
but what are you talking about?
That's why I stuttered a little bit.
Anyways,
So let's go back. The question that you
See.
asked. So you're saying that all these problems with men are basically psychological or about
most
the
of
sensitive.
it, I think,
Yeah,
or some.
there's no medical condition lying somewhere or something.
There could be medical
There
conditions
could
lying
be,
somewhere.
okay.
There could be. Like, I cannot say for certain.
Okay.
I wouldn't like to like say something that I'm not very sure of.
Okay.
So, but I can't say the ones I'm very certain about are the ones I can like say categorically that this is this and that is that. But there are medical
In
conditions that can
some-
actually
yeah.
predispose people. Like, look at people with benign prostatic enlargement.
What?
Benign prostatic
What's that?
enlargement.
Prostate.
Yeah, prostate. Yeah, well, yeah. I would say benign because it's not prostate cancer. I don't know if prostate cancer came to your mind.
Oh,
Yeah,
the
that was
swollen
okay.
scrotum thing.
Not swollen
Not-
scrotum. That's a different thing entirely.
Oh, okay.
But benign prostatic enlargement is kind of like is the commonest. You see it in elderly men where they have difficulty urinating because the prostate gland is enlarged and all
Oh,
that
wow.
stuff. So
I
that
didn't know
can
about
also
that.
affect
I didn't
aging.
know about that.
I
Definitely
didn't
can
know
also
about that.
affect
Okay.
all those kind of. Most of the people that come to urology clinics, that's the clinic that handles men and their reproductive organs. Those are most of the things they present with, either benign prostatic enlargement, erectile dysfunction, or things like prostate cancer and the likes. And then they have to remove that gland and the likes like that because the gland also contributes to the whole semen and feeling of pleasure in men and the likes like that.
So, do you think enough Gen Z men come into the urology clinic for checkups or to just?
In my own experience, from what I saw in my junior surgery posting, is old men that
Old men.
mostly we see there.
Gen Z men, please
Young-
take your
young
health
guys are-
seriously.
And they
Young
also they have a lot of underlying conditions. They spread a lot of things all around, and I wonder why the pressure is on women to take their health seriously, and men just feel like they just have to sit back
Everybody should take their
and take their
health
exactly
serious.
like it's not a gender thing. I think men also should take.
Yeah, I think we should even have another podcast session for
men. Yeah,
because there are a whole lot
That's
of
why-
health issues, and
yeah.
you know, unlike the days of our fathers now, where those ones they are not exposed to a whole lot of things we are exposed to now.
Yeah.
A lot of things we take now. We take shisha,
alcohol
we
and
smoke
all of
shisha,
that.
you take alcohol,
And this
excessively.
balloon
And
thing
there's
is-
something. There's
What's that?
What-
That's
what do they call it?
NO2 or
something
something.
Yeah,
Nitrous
yeah,
oxide.
yeah,
Nitro-
gas.
Nitrous oxide.
drugs, different types of drugs.
And there's
trap-
something in medicine. You can almost not go wrong if they say risk factor for any disease, and you mention smoking or excessive alcohol intake, or you mention genetics, or you mention family history. You almost wouldn't go wrong with those things. So smoking is one of the causes of almost anything that you can think of. Smoking, and most
See?
people say shisha is flavor, is this, is
I
that.
think it's much
more- I
more
think it's
much
more
more
serious than
dangerous.
even
Yes, because
and vapes.
every I don't know how they set it up, but it's about 200 sticks of cigarette. I'm not sure anybody can
A
actually
lot of
sit down and
nicotine.
Just
smoke.
one
Yeah, a
pot.
lot of nicotine.
So that's like
and
200 sticks of cigarette, and one person, two
puffing
people will
it.
split that pot within themselves. And even a chain smoker cannot smoke 200
Never.
in a day.
in a day.
But you see people
That's
at the
a lot of
shisha
nicotine.
spots with two.
And it's not
3
just
pots.
the chemical, mind you. There's a coal on it. That
There's
coal
a
too is
coal.
chemical.
Yeah, that star and all the likes like
Yeah.
that.
Are there like resources for women going through all these health issues
For them to
Where-
read.
where
On-
they could maybe get support? It might
Like
not
a
even be
community.
like community, like wherever.
Well, before I get into the community thing, I first want to point out that not everything we see online is accurate information, which is one of the challenges that health practitioners face when trying to address some of these things. Some people will be like, oh, I read it on Google, I read it on this. Now, the thing is that Google diagnosis and what your doctor will tell you most times may not be the same thing.
Yeah.
And you say, okay, some people will come into the hospital and they'll be like, doctor, I have this. And the doctor will be like,
How do
How
you know?
did
How
you
did you
know
figure
that?
out?
were you the one that diagnosed yourself, or are you? And they say, no, I just read about this and I read about this, and at the end of the day, if the doctor was being sassy. If he's being sassy, he can tell you, okay, go continue your
treat
management
yourself.
on your own.
On
You
your
don't
own.
need me. But then you'll be like, okay, I'm sorry, and this and that. And then we get into the real history taking, okay, what happened? And then we get to a different diagnosis from what you read on Google. There are certain times, there was a time that I thought I had esophagitis because of
What's
what,
that?
like
What's that?
inflammation of the esophagus, because of what I
Oh,
read
God.
on.
Yeah,
And
that-
I always
that's
see
happened to me a
something.
lot of
And-
time,
and
but-
then
Don't Google
Yeah,
your symptoms.
And at the end of the
Google
day,
it.
Not
what
Google
I
your
had,
symptoms.
at the end of
Just
the day,
give
what I
yourself
had was
hypertension.
GERD, acid reflux.
Oh.
That was all. I was already panicking and all the likes like that. So many other cases too like that.
yeah.
Anything you start feeling this, you start feeling that.
Mhm.
Okay, you Google it. When you get that
Google will
aside,
give you.
And sickness is very
That's
weird.
why-
The
that's why-
moment you Google it and you put it in your head, you
Nah.
start feeling those symptoms.
exactly.
That's why I make conscious efforts whenever I go for a checkup not to say exactly what I read on Google, because I have like
My
You start to have,
my
like,
dear
it's more like a
brothers,
confirmation
yeah.
bias.
like they always
Mhm.
if I tell them I have this, most time they'll tell me, you have it. Oh, who told you that though? So I always make conscious efforts not to say exactly what I know.
Brothers and
I
sisters,
don't act
do
like,
not Google
okay, I
your
don't know.
symptoms, please.
Because doctors are so sassy, let me just say that. And they're so
Well,
proud.
maybe not all of them, but still. The thing is that patients too can be very they can be
Okay.
very difficult to work
Okay.
with. Like today in clinic, I saw a patient that you had
You seem
you had to
frustrated.
decide. Yeah, the doctor was frustrated because he had to, madam, just tell me where the pain is. You understand? Like, where exactly is the pain? The woman started story. You know when this, like,
She has to
I
let
want to
you
help
know
you.
now.
I have other patients
Go,
I need
go,
to
go,
see.
tell me.
Exactly where the pain is. Go straight to the point. He then started, okay, maybe, because the doctor felt like, okay, maybe I was not explaining enough. He called somebody else. Okay, come and be interpreting for me in Yoruba so that she understands exactly what I am saying. Those are some of the issues with doctor-patient relationship. It's not like as if, these people are kind of like, most of the doctors here in Nigeria are overworked and underpaid.
Yeah.
And you cannot expect somebody that is already frustrated
Mm.
to, like, you see a lot of patients, even in the teaching hospital here, we see a lot of patients, and then as a patient, you are still sassy, you are still fighting with probably the only doctor in, for instance, now in the whole of Ekiti, there are only 2 maxillofacial surgeon consultants.
What did you call it?
2 maxillofacial surgeon consultants.
What did they
And
do?
they kind of like do this, they are like dental surgeons
Okay.
with a lot of, with more specialty. The
Okay,
maxilla is somewhere around here.
Maxillofocus.
Yeah, so maxillofacial, they deal with the
Facial,
maxilla
okay.
and things that has to do with the face, maybe surgeries
Okay.
or the likes like that.
Like that. Okay.
There are surgeons that just work on parts of the
Part of
faces
the
and the
face,
likes like
okay.
that. And you imagine just 2 in the whole of
Middle of
Ekiti,
Ekiti.
and then having to deal with the number of people that are here. Those are some of the issues that would arise, and you don't expect them to see everybody.
I just think that people have been conditioned to think that the doctors don't know what they are doing, so they want to explain like they want to tell you exactly what is happening, and how it
or
started.
maybe the doctor will give them something else.
Something else. Yeah,
something
people have been
bigger,
conditioned to
like,
believe
okay, I
that
already know what's
all
up
these
with me.
doctors, they know you get, so especially elderly people. So they want to
Yeah.
tell you exactly how they feel. They don't want to hear from you
Mhm.
at all. So I think that's why people do that.
Well, so basically, these things that
Mm.
we were talking about is not health issues for Gen Z. It's for
Nah.
everybody.
It's for
actually.
everybody.
And I just feel everybody should prioritize their health,
Yeah.
men and women even. So I don't know if there's any advice you want to give to people concerning all this.
Well, the very first thing is, like we said, don't Google your symptoms. If you have anything,
Never.
you come to the hospital, and when you get to the hospital, the very first point of contact would take your history, would get to know what it is, and then based on what they feel, they would then refer you to the specialist clinic in charge of what they think is wrong with you. And then when you get there to then, like, expertise management will then commence, and that is the only way. You can't treat yourself. It's just the grace of God that many of us are living in Nigeria. I feel headache, I feel feverish, it's malaria. We go buy malaria drugs and the likes, and we use it, and well, God so good, it clears up and the
clears
likes that.
up,
And we feel like, oh yeah, well, I understand how my body. Some of them will come and be like, oh, I understand how my body works. You just need to give me this. You just need to give me that. I'll be fine. Whereas some other times, something else is going on underneath that needs to be closely examined. But when you come to the hospital, you're being checked out thoroughly. A doctor is trained to look at you holistically. And when they check from head to toe, they see that, okay, this exactly is what is the problem. Then they advise on management, and then they treat you to the best of. It's a doctor's joy to see that you are well. It's not. That's why when people go to church and say, "Oh, the doctor said I would never work, and now I'm working," praise the Lord. It's not like as if it's not the doctor's joy to cut someone's leg off. It's their joy to make sure that you actually can walk out of the hospital on your own. Because every doctor, once I treat somebody and I see the person is fine, that means I know what I'm doing. I know my craft. So it's when you come to the hospital, you are looked at holistically, and then you know what exactly is wrong depending on what it is, and they treat you.
Okay, thank you, Chief.
So what symptoms? What symptoms should people look out for PCOS?
Like I said,
like once you start seeing these things, you're supposed to go to the doctor.
Like I said,
you said it before, but I just wanted
the absence of menses. A young woman that is not menstruating is a sign. Then you see male pattern of hair, a woman starting to develop facial hair. Then you see alongside the facial hair, acne, or you see a young woman starting to have alopecia. She's starting to bald. And those are some of the major things that you notice a deepening in voice. Like you notice someone that has a very thin voice, and then all of a sudden, or the voice just starts to progress into something very deep. It's something like that too. Yeah.
All right.
See.
So we appreciate you for coming.
Thank you,
Chief Isaac. Me, I go to call you Chief. Now that Chief, I like it.
It's actually really nice.
It's nice.
Yeah.
Thanks. You. I think we have a very insightful session.
Yeah.
And
yes, I enjoyed learning.
I've learned a whole lot of stuff.
I did.
I've learned a whole lot of stuff, and I believe people out there too learned. Maybe when we want to discuss something along this health line again, we'll invite you.
We'll be glad to have you.
Glad to have you.
It's my honor. Like I actually,
you don't have to be humble. You don't have to be humble.
Actually, kind of like it's something, because to talk about health stuff with people, it gives me joy.
I can see the smile.
Yay, man! It's such a good teacher.
Nice. Thank you very much. Thank you very much for coming.
Thank you.
So, watch, like, subscribe, comment, share. Please share our videos, especially this one, because a whole lot of people need to know about these things we talked about today. Share to all your family, friends, everybody. Share,
subscribe too,
and subscribe.
And you can ask questions.
Would
Chief Isaac
can always
answer you.
Respond.
Yes.
Offline.
To the best of my
knowledge. Your knowledge.
Okay.
All right. So thank you very much.
Thank you, Chief Isaac.
We'll see you another episode of Yarns and Trends.
Bye.
Bye.